all. Thanks so much for joining. Speaking of making healthcare work for you, different perspectives and empowering solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and we're talking about our interview with Dr. Kim Butler Willis, who is a co-founder and managing partner of Goodstock Consulting. And Goodstock Consulting started in 2017. It was actually, it was the brainchild of Kim and then a few of her friends after the Emanuel 9 shooting in Charleston, South Carolina in 2015, when Kim lost a family member. And she said, you know, if I could die in church, then I really need to make sure that I'm spending my life doing things that matter and making a difference. And so that led her to form Goodstock Consulting with two of her friends. And they're focusing on strategic ways to help with diversity, equity, inclusion in different industries, but have done a lot of work in healthcare with some pretty big clients. And it's impressive to hear her talk about it because she realizes that talking about diversity, equity, and inclusion is not an easy topic for anybody involved, and that there's a lot of work to be done. And some people are more receptive than others. She talked about red light, yellow light, green light people, you know, where are you with the conversation and their receptiveness? And then she talked about three things. And one of them, she said, appreciative inquiry, human-centered design, and then edutainment, which I thought was funny. And she talked about approaching things from those three ways. And it really just centered all on humanity. It went back to humanity. We all have good in us. And that's where the name Goodstock Consulting came from. You come from Goodstock, and there's all common ground that you can have and start with. And so she shared so many great stories of connecting with people and changes that they've made, and just how that drives her forward. But it was really impressive conversation. And I don't want to share everything because I could tell a million stories about all the things I loved about her conversation, but it was really impressive. And I just thought her level of thoughtfulness and just her humanity for other people and finding the humanity in them really goes a long way. And they are clearly driving positive change because of their approach to this and their passion behind it. Apoorv, what stood out to you about it?
Yes, thank you, Steph. I think Kim was just a wonderful person to speak to, very inspiring, really the kind of guests that we love to have on the show, because they're talking about not what's not working in healthcare, even though that's what we're all trying to fix, but they're trying to find the things that are working. That's the essence of appreciative inquiry, her whole technique. It's not about going into a community and saying, oh, you have such high drug addiction rates and alcoholism and criminalism. And anybody, we can find that in any community, you know, you name it, the top communities in the world, you can find that, right? So if you want to start being negative, the whole premise of appreciative inquiry is going in and starting to think about what is working and what are the rays of hope and how can you start appreciating those and then maybe building on those. So I think that's essentially the nature of what Kim is also bringing. I mean, it feels fundamental to who she is. She's trying to take that approach to the leading healthcare organizations, pharmaceutical companies, hospitals, and providers in this country, and really bringing them to a place where they can truly connect with the topic. It's not simply about being able to roll out a program and check off a box and say we're doing it, but it's about then getting them to a place of vulnerability and getting each individual person who's participating to that place of vulnerability so they can really be examining their own thoughts and insights and biases. So it's a very deep approach and very profound approach that she's taking, and you can see why it has such potential for impact. So I really love her whole approach, and I love her optimism. I like the way in which she also connects the points related to the framework of the quintuple aim that we talked about and why that's essential, even though, again, we could think that we are so many decades behind where we need to be in healthcare. Again, another example of just a very inspiring approach to a very challenging problem.
Absolutely. It was a really amazing conversation. I'm super excited to share it with all of you guys as our first interview of 2022. So be sure to stay tuned for the full interview with Dr. Kim Butler Willis on Thursday. We'll talk to you soon. Bye-bye.
Bye-bye.